on looking at, okay, so we have a little jaw pain. I'm looking for a pernicious response that illustrates my neurosensitivity associated with myofascial contraction. So the pole is good, neck is good. Withers, I'm giving it a 2. Our tricep is probably a 2+. And so we're a little bit heavy on the forehand, so our bicep is maybe a 2. So we're a little heavy on this forehand. If you notice, look at this, and if you can recall how he moves, you're going to see something very similar to what he's doing right now. Okay, so coming back over here, ribs are good until we get to the 14th, 15th, and 16th rib. The serratus dorsalis is tight. Now why is that tight? Because he's guarding for the hind end. Okay, so we get to the lumbar. L2 has a little bit overbuilt. L2, L3. SI is good, middle gluteal is good, superficial gluteal is good, but then the bicep femoris, very tight. Psoas muscle is crazy tight, so we have to work.
Micah, can you turn off the radio, please? Thanks.
So we have to work to stretch out that psoas muscle because it can't have hip flexors like that. Okay, now let's go to the worst side. And realize that, as you know, myofascial work is important for any athlete. And now that you have the tools, okay, so a little jaw pain. Okay. And then the neck, a little bit right here, probably at C6 and C7. Okay, the withers bilateral. But in the tricep, we don't have that same neurosensitivity pattern, so we don't have that tightness, and that's why we're not seeing that. Okay, so coming back over here again, 14, 15, and 16 in the rib cage. Okay, again built up in L2, L3, L4, and now the SI, middle gluteal, superficial gluteal, and bicep femoris. Okay, so these areas are tight, and we need to take care of this, take care of that left hip, and by doing the stretches. Shall I show you the stretches, or we've done that before?
Yeah, let's do them.
Okay. Okay, so I've shown you methodologies on how you can relax these before you do the stretches. You ready for this, Micah? Okay. So, taking your light, and realize the light I have found to mimic a class 3B laser in wavelength, and what that does is helps you relax the muscles so you can get the stretch done a little bit better. So, neural engagement in these distal points cause the method of recruitment up to the spinal cord to relax those muscles. So go to the middle of the foot, go up an inch, and to relax the rib cage and the SI. Either foot can be used. You go over an inch.
You done?
And you'll apply it here for about 30 seconds. And this will take care of the ribs on both sides, the right SI and right gluteal tension, which will facilitate the exercises. Okay, so after about 30 seconds, I'm only doing about 20 because I feel we've gotten enough as far as getting that methodology down. Now to do the hips, I want you to go to the metal, and then I want you to go over 2 inches. Engages the femoral nerve, and then there's recruitment going up to the spinal cord. So about 2 minutes. And realize that this light is specific. I've tested about 20 lights to find the ones that work the best. I don't have to go for the $20,000 class 4 laser. We go with a $45 bike light.
Okay, thanks.
Okay, good. So now the tension that was in his back, in his SI, in his middle gluteal, in his superficial gluteal, in his hip, in his bicep femoris is diminished.
7.
Okay.
Oh, okay.
So now let's do the stretches that are going to, that does it bilaterally. So the ribs on both sides are relaxed. I do about 2 pounds of pressure over these points following the neural patterns of the spine, neural course, and realizing that when there's repeatability per animal, and so that my grading scale is, we have a little bit there, but nothing compared to what we're going to. Okay, so now let's do the gluteal sacral release. So essentially you're taking this pelvis and you're rocking this pelvis this way. So put your branches here, do your massage that's going to open up these gluteals. He's still really tight, so that tells me that we need to work a little bit harder if we're not doing these. Do these before and after. So do a sweep out, sweep out, sweep out. Come to this iliac crest. Put your left dominant hand, and then hang. We got a lot of junk in the trunk, and realize what you're doing, so don't be bashful about adding pressure there. Let's do it again. And hang again. Okay? Remember, I'm not doing adjustment. All I'm doing is stretching the anterior and posterior sacroiliac ligaments and helping to take the pelvis and rotate the pelvis down to encourage the sacrum to pull away. And that's with the tightness. Okay, now let's do the flat top, which will help with the psoas muscle and the hip flexors. So you find the highest point, and the top you're trying to flatten is the croup. Go to the highest point, go up 6 inches, go 2 inches off the midline. You should be at about L2 or L3. And apply pressure, just enough, probably about an inch, and flatten that croup. And hold that for about 10 to 15 seconds. Crazy important for that psoas muscle. Horse is working really hard. You can't have that psoas muscle lose because we'll lose impulsion. Good? Okay, so now let's come back over here. And we have this wither tension, realizing the withers are, 18 inches, 16 inches, 15, 14. So they're really long. So find the spinous process, the dorsal spinous process of the withers. If you're right-handed, go to this left side. Realizing that I've gone through multiple evolutions of this stretch. So it's like iPhone 8. On this stretch, I call it the walking the withers. So find the spinous process. Put 2 fingers on that spine and just feet apart because you want to be pulling from the shoulder and just do a slight vibration. 1, 2, 3. Slight vibration. If you do it hard, he's going to react angrily. Because what this is going to do is relax the inner osseous ligament in between these dorsal spinous process, and it will take care of the rhomboid trapezius tension that we were illuminating on the paniculus response with the needle counts. Licking, chewing, taking to feel better. And so now that rhomboid trapezius are relaxed, and that's what we want to achieve. Okay, so we have this tension in this tricep. Okay, so let's open up that tricep, and I'm going to show you a two methodologies using the same thing, using the same light. Don't look at the light. So I find the pectoral ridge.
Dr. Jim, can we rule out that this is related at all to laminitis or anything?
Yeah, I don't see any laminitis.
Okay.
Laminitic horses are going to be very tight on both shoulders. I mean, uber tight. So uber tight you can bounce a quarter off of them. They're going to be very tight in their brachiocephalicus. Very, very tight. It's not just a subtle go. It's harsh.
Okay.
It's harsh. So that remember that footfall on that left 4 is because he's offloading off the right hind.
Okay.
Okay, so in for a penny, in for a pound. If you're going to use the light muscle, use the light and take care of it. Relax these muscles. It's a method of depolarization, and it's a neural engagement, neuromodulation with a photoelectric process. And what it causes is the calcium to leave back into the endoplasmic reticulum, and the actin and myosin relax. And so then, with that relaxation, we get relaxation of the